Good afternoon, everybody. This is Tracy Underwood and Judy
Chen, hi.
from the Washington State Coalition Against Domestic Violence. We also have our partners at WCSAP on, if they want to say hello.
Hello.
Jean.
Hello, this is Judy. This is Jean.
Welcome, welcome. All right. Just wanted to say, welcome to everybody, that you're here to talk about planning for your VOCA application, improving compensation. We have a full agenda today. We will be starting off talking a little bit about good jobs and starting or updating your compensation plans. We're going to talk about working with your board or tribal councils, have some examples and some financial models, talking about preparing for those unintended consequences around change when you have changes in your organization. We're going to talk about the application itself, a bit of an overview and where to go for help around that, and then more resources at the end. All right, a bit of housekeeping before we get started, as people still trickle on a little bit. The best way to listen is through your computer speakers. Remember to unmute those speakers. But if that's not working, you can also listen by phone. There's a choice in your control panel, and there's a picture of it right there where you can switch from mic and speakers to telephone, and then you enter the PIN that it gives you, and you should be ready to go there. Let's see. The next thing is everybody is on mute. That helps us. We got a lot of people signed up today, and that really helps us with keeping the background noise down. So we're going to keep everybody on mute. However, there are a couple of ways you can communicate. You can raise your hand, and I've got that circled there in your control panel. You have a little hand. When I see a hand, when we pause, when there's a moment, I will unmute you, and you can ask your question. That only works if you're calling by telephone or if you know that you have a microphone as well as speakers in your computer. If your computer doesn't have a microphone, we won't be able to hear you. The other way you can communicate with us with questions or comments is your questions box, also located in your control panel. You can enter questions and we will address them. Either we will address them as, we'll be able to address them to the group, or we will type in answers to your questions privately as well. We are recording this webinar so that folks who couldn't make it today can be able to view it, and also if you wanted to go back and take a listen to something, it's there. So just wanted to let you know to keep that in mind. We will be recording. All right, if your control panel disappears, which it tends to do, you can bring it back with that little orange arrow. All right. So, as we get started today, we want to know, what are your burning questions? What are you hoping to learn today? What were you really hoping to get out of when you signed up for this webinar in your planning, compensation planning, and thinking about this VOCA application? So this is a chance to test out your questions box skills. Go ahead and put in the thing that you were really hoping to get today into the questions box. We might not read them all out, but we'll read a few. And we will, if we don't get to something that you were really hoping for today, somebody from WSKDIV or WCSAP will follow up with you. All right. I'm just going to pause for a moment while people type, and we'll take a look. All right, this is great. We're getting a lot of feedback, which is awesome. Hold tight just for another minute while we collect the responses.
Okay. Hi, everyone. This is Judy Chen. I'm going to just note a couple of these questions, and we will also be taking notes as we go here. So some of the questions that people have is, how much money is it okay to ask for? That's the number one question, isn't it? What's the overlap among the different contracts if your organization does both DV, SA, and crime victims, for example? What's some of the timing around the application process? What's the difference between enhancing FTE and enhancing programming, and what does the FTE enhancement mean? FTE enhancement. Are there any things that it's really important not to do in the application? How many years can we count on this funding? Is it sustainable? That is personally, that would be my number 2 question. And then how can we really, what kind of proof do we need to provide that we really need the money? So those are some of the questions that we will very much attempt to get to. There are a couple things that are more contract details, and I think that what we'll do with some of the questions that come up that people have written in is we'll also be checking in with OCVA and DSHS, so that would be Chris Fenno and Susan Hannibal. I believe, is Susan Hannibal on the with us today?
Not sure.
Okay, not sure. So we'll be getting more information out, and then there's also a question period, an official question period. So Susan is with us. Susan, if you care to respond to any of these, or if anyone from OCVA is on, you're welcome to as well. There's an official question period for this application process, so we'll be sharing some of this with OCVA for that purpose as well. Okay, thank you for these questions. Super helpful.
All right.
Okay, so the big overview is we did this. So congratulations to everybody. OCVA and DSHS participated in or launched a statewide planning process where they asked for a lot of input, and boy did they get a lot of input. So I really want to thank everybody on this call and all of our colleagues. OCVA received input from over 160 people in 5 different discussion sessions that were held around the state, as well as people who responded to an online survey and submitted comments. And there was also a feedback session. So really, this is based on feedback from the fields about what we need to be doing to better sustain quality services for survivors. And that's super terrific. So you talked, they listened. This compensation enhancement and FTE enhancement is the first phase of several phases that OCVA and DSHS will be rolling out. So watch for news about program enhancements and expansion funding. And we've put in a link here. How can people see the links, Tracy?
Oh, I forgot to say, thank you, Judy. In your control panel, I should have had a picture of this as well. There's a tab called Handouts. You can click on that, and in there is the PDF. You can download the PDF of this presentation. You can do it right now and follow along with us if you'd like, and click through the links as we go through. There are live links in that.
Okay, thanks.
All right. So what we know. So we're going to just start by giving a little bit of data from our most recent WSCDIB's most recent wages and benefits survey, just to sort of frame the idea around, why we are talking about this kind of stuff, which I think most of you already know, but also to let you know that this is a resource that's out there for you as well. You can contact me and I can get you the survey results, or if there's something not in the summary that you're looking for, I might be able to dig through some data and figure that out, because we've got a lot of data from this survey. So we surveyed 323 participants from 56 programs, responding from almost all of Washington counties. This is the statewide wage data that I've put out here, both averages and medians, but we also have it broken down into urban-rural codes, which was a way to break it down into smaller bits and not have it such a big, wide, statewide numbers, but also protect some anonymity for agencies that might be the only ones in their counties and whatnot. So I'm happy to explain urban rural codes and those data and get you the data from your county's code or from other counties' code, whatever you would like. I'm happy to give you that information, and that's available if that would be helpful at all during this process. A few tidbits from the survey. We found out that 39% of the folks participated had children under 18, and 36% were the sole provider for their household, and 14% of the folks that we surveyed were both the sole provider for their household and have children under 18. That tells us a little bit about, who we are, who our advocates are, and staff. And, it was, I believe, 83% of the participants said that they rely on some other something to make ends meet month to month. Most people said it was a spouse or partner, as you see in the table here, but many people had a lot of different ways people were making ends meet, and that other includes child support, student loans, donating plasma, things like that. So just a little bit of a picture. Something else that I wanted to talk about was the Self-Sufficiency Standard, which is something that determines the amount of income that's required for working families to meet basic needs. And it really is for meeting basic needs, like scraping by, but they're doing it sort of standard. It's not a like living comfortably standard. It's really just making it work. And it takes into consideration costs in certain counties and areas around the state, including housing, childcare, food, healthcare, transportation, taxes, and miscellaneous costs. And you can use it through the calculator.org. You can find out, what the self-sufficiency standard in your county is for a specific family makeup. It asks you to put in the ages of the family. So if there's two parents, there would be grown-ups in that house. And then, if they're teenagers or if there's preschoolers, all of those things factor in because childcare costs are different depending on the ages of the children and that kind of a thing. So that is there as a resource. And when we looked at the self-sufficiency standard for the data that we got through the wages and benefits survey, we found that in all of the counties where we had participants from, advocates were supporting themselves, were able to support themselves on the wages they were making at our programs. When we added in an advocate and a preschooler, somebody who was supporting their preschooler by themselves, there were only 7 counties in our with the data that we had that somebody would be able to do that, and those are listed there. And for an advocate who was a single parent supporting both a preschooler and a school-age child, there were no counties in Washington where a single parent could support a preschooler and a school-age child according to the self-sufficiency standard. So that's some information for you. And I think that's all of the info that we have from the wages and benefits survey. I just wanted to give you a tidbit. Really, this is kind of scraping the surface as to what we have data-wise. So please let me know if you have questions, if you're wondering, well, maybe they have some data on that. Shoot me an email, and my contact information is in the presentation if you download it from the handouts. And ask me. I might be able to figure it out. We asked folks, I was wrong, I've got 2 more slides. We asked folks what their least favorite things were about their job, and by and large, wages stood out. And I made the Wordle here based on responses, and you can see the most popular responses, and wages really stood out as the thing. But we also asked people what was their favorite thing about their job, and people had a lot of great things to say. And so I wanted to put that in there too, not just talk about the bad stuff. But people are really love what they do. They love working with women, supporting survivors, and doing the community work that you all do so well. All right.
Okay. So one of the questions was what not to do, and one of the things I think not to do is not to forget to start with your organizational values, or stated positively. How are your organizational values going to guide your decisions? This is important because getting clear about values is important because decisions around money and changes in pay can actually be very difficult for organizations. It can be very difficult internally for staff morale and with the board, and then also with your peer organizations. So it's really clear, it's really important to get clear on things like fairness, for example, and equality. By fairness, do you mean that everyone gets treated the same, or that different people need different things? And that will influence how you handle wage increases or how you offer benefits that some staff will take advantage of but others won't. So for example, a flat dollar increase benefits the lowest paid staff more than it benefits everyone else, while a percentage increase in pay benefits the highest paid staff. So again, thinking about, how do you all define fairness and how are you going to explain that and defend it? When you're thinking about boards, for those of you who have a board of directors or with tribal council, questions around risk and sustainability of funding are often where we hit the wall of no, right? And that's often where governing bodies say, wow, that's too risky. So really being able to make a case for how your proposal, as you go through your internal process, how it's fiscally responsible and how it will benefit organizational stability is important. For example, investing in staff can reduce turnover. Sorry, I'm having my eyeglass problem. Do I put my eyeglasses on or do I take them off? Okay, aging eyes, people. Let's see. So how will our proposals for increasing staff pay increase our organizational stability, reduce staff turnover, invest in the current infrastructure rather than growing unsustainably? Those kinds of framing can be very helpful, especially for boards of directors that really want to do the right thing but want to know that you're thinking about this as well. And something that we've heard over the years from many directors is, I keep going to the board and saying that we need to increase pay, and they keep saying, no, we can't afford it. So how can you predict that kind of conversation and think about how you're going to shift it to have a different kind of conversation where you'll be able to have a getting to yes dialogue around these are good investments for us. Okay. See, next. There we go. The next thing to do, and this parallels with the application process, is identify the problems that we're trying to solve and what your goals are. So that's the first part of the application narrative. So for example, are you facing high turnover as a consequence of low pay? How would providing living wages address that and then support more stable and sustainable services? So that's that little arrow going from left to right. Tracy did these, they're kind of cool. And then another problem that programs often have is, hey, we're serving an increasingly language diverse population, maybe 20, 30, 40%, 50% of the population doesn't speak English, but we have a hard time keeping bilingual staff because they're very sought after and they can get paid better at other employers. So how are we going to address that issue? Well, one way to address it is by providing a pay differential, which is a pretty typical approach, both with government employers and with nonprofits. And would that help us have a more diverse multilingual team? Another problem to solve is related to compliance with labor law and changing labor law. For many, if not most of you, coming into compliance with the new FLSA rule, the Fair Labor Standards Act, will be important. For some of you, compliance with labor law in regards to on-call staff, on-call coverage. For some of you, that's a gray area or something to consider. You know, can we get ahead of what might be a problem and provide pay that is, provide more pay for on-call time. And then for some of you also, there's a new minimum wage in your county. So those will be problems to solve. And then just in general, and Tracy will talk about this more later, that for many of us, we have employees who live on the edge of poverty, and that destabilizes that kind of circumstance is just not very stable for the organization. So if everyone can earn enough to focus on their jobs and not worry about the kind of stress that comes from living on the edge of poverty, they're able to provide better services. And then also it meets our values around everyone here would earn enough to be able to leave an abusive situation if they needed to. Okay, so then, you know, we might have a lot of things that we want to do. What are your priorities? So here are some examples. Some other examples are getting pay and benefits up to a competitive level. For many of you, I've heard directors over the years say things like people come here and they really get trained, but then they go and work for the county where they can make a lot more. As a DV advocate, we're not competitive with them. And also making health insurance premiums more affordable. So I wanted to just pause and ask you to reflect on, you know, what else might be your priorities.
You can raise your hand if you'd like to talk about it, or you can type it in.
Okay, so about the FLSA, somebody just wrote and said, you know, are nonprofits that earn less than $500,000 a year in for-profit income, do they have to comply with the new standards? Well, that's a good question. Let's move to the, can we move to the next slide?
Oh, hang on. I've got a, yes, we can move to the next slide, but I've got a hand.
Oh,
and
great.
also
Okay.
somebody else said retirement plans
Yes.
were a priority, a priority to
Yes.
think about as well. And I wanted to ask Susan Segal, you have your hand raised. I'll unmute you, or you can lower your hand if you did not have a question, because I think it's been raised for a little while. Okay.
Oh, there she
is. Yeah. Rogue hand raised. Okay.
And Dan, thank you for raising the retirement plans. You know, for many of us who've been working at DV programs or SA or crime victims programs for a while, I don't think we really pictured that we would be retiring from this work because we thought we would end the problem 20 years ago, right? But it turns out that retirement is a big issue in the nonprofit world, especially in human services and crisis services, that people do need to have the means to retire. And oftentimes our employees don't. Okay, fair labor standards. So most nonprofits have exempt employees, and exempt employees who earn less than $47,476 a year. That amount, $47,476 a year, or $913 a week, even if part-time, that's the new threshold that's been set by President Obama's administration, and it's the final rule for the new FLSA standard, the FLSA rule, around the threshold for exempt employees. Exempt employees who earn less than that by December 1st will either need to be paid overtime for hours that they work over 40 hours a week, or will need to increase their salaries to that amount. So again, anyone earning less than this amount who has been exempt will need to be paid overtime if they work over 40 hours a week or have their salaries increase. The thing I want to point out is that in our salary survey, what did we find out, Tracy?
Well, we found that of the directors who participated, which were 28, 36% of those directors earn less than this number, 47,476.
So the thing I want to say about this is that if you are a director who earns less than this, don't feel bad because you've got a lot of company. And this is really typical of our field. This is what's happening in human services across the country. People are saying, wow, we've got a lot of employees who are exempt, who might even be the highest paid employee or the person who has the most responsibility at this organization. And we're going to have to figure out what we're going to do because the threshold has doubled. It used to be about $23,000 a year, but now it's going to change effective December 1st. Now, does this apply to human service organizations or any nonprofit that have less than $500,000 in earned income? Well, that is a big question because that is in the rule. However, what's also in the rule is that if there's any interstate commerce that employee engages in, then it does apply. And what we have been hearing pretty much across the board on, with labor law attorneys, nonprofit management support organizations, just all the people who are compensation experts, human resources experts around the country, is pretty much everyone is in agreement that if an employee goes on the internet, orders things, off of the internet, for example, from Amazon, receives donations, just sort of does, if they exist in the 21st century with the kind of communication that we have that's across state lines, then yes, it does apply. So, of course, though, I'm not an attorney. I think that all of you who know me know that, and this hasn't been decided in the courts. It's possible also that Congress will repeal all or part of this, but overall, people are saying, hey, we're going to have to come in compliance with FLSA. So this will be a priority for many of you with the VOCA funds. And I want to just note that we're not all, those of us who are on the Denise, do you want to speak to this? It sounds you have a couple of comments. Yeah, we're going to find Denise. Denise, you're unmuted. It sounds like you have some comments. Denise, are you with us?
She might not have a
Okay.
microphone.
Okay.
We can't hear you, Denise. I'm sorry.
So I just want to note that we're not all in agreement about this, about the interpretation of this, and that's fine. I want to refer you all to an excellent webinar that's provided by the nonprofit management support organization called 501 Commons. They've been putting out a lot of material on this, as has our colleagues at the NNEDD. And there's an excellent webinar that's recorded that's on 501 Commons by Compensation Connections and folks who used to be at Washington Employers Association. So if you want to dive more into that, again, I'm not an expert on FLSA, and you don't have to agree with me on the interpretation. Feel free to check those resources out for yourself.
I believe we have a link in the resources section at the end to that webinar Judy just talked about.
Yeah, great. Okay, now I'm going to turn it over to Jean at WCSAP. Hi, Jean.
Hi, Judy. Thanks. This is Jean at WCSAP. Wanted to talk a little bit more in detail about what is compensation, what could plans look like, how do you talk to your governing authority about that. First, though, to make sure that we're kind of all on the same page with compensation, I think often we go straight to more wages, is that we're really talking about the whole package. So compensation is really a systematic way in how you're talking about providing monetary values to employees for the work that they've performed. And as Judy had referred, it can achieve many different purposes around assisting in recruitment and job performance, job satisfaction. It can help with retention, morale. So when we're thinking about compensation, I think a little bit broader, not just base pay, overtime pay, bonuses, but also medical, dental, vacation leaves, retirement, etc. The one thing that we're not really talking about today, but I think one thing that we started out today is that this is a really great opportunity that VOCA has afforded us. And in the process of gathering information and hearing what's needed and what can be most successful, don't forget about those kind of intangible or non-monetary perks that you can often have around flexibility of time, looking at self-care strategies in your organization. So we're not going to really delve into those, but just know that there's other ways or other things that may come up in this process as you go through it that you may want to look at as an organization. Next slide, please. Tracy, we don't have control of the slide. Thanks.
Oh, I thought you were controlling the mouse just a second ago.
Okay. Thanks. So compensation planning, what we're really talking about is clarifying your goals. As we've talked about so far, like, don't sell yourself short here. Really think about how do we move away from scarcity of resource thinking, and how do we really move towards how can we be most successful as an organization? How can we support our workers so they can support themselves? How can we compensate the very important skills and experiences that they bring to the job? And also how do we have a sustainable wage that can help folks in their life? I'm not going to go too much the values and priorities since Judy covered most of that, but I think one thing that we heard in the questions really, like, how much is too much, right? Or what are our limits, or how do we justify? So I want you to think about it as we're going through some of these steps in the next few slides, that you really want to identify what are your drivers in your organization, taking a step back to think about where are we, where do we want to be. Some of the items and priorities that Judy talked about is, equity, recognizing the skill sets that people bring to the organization, as well as how do you retain them, how do you keep them there, right? We don't want to provide opportunities for people to build their skills and then leave to the county where there may be a higher salary, but how can we be most competitive in what we're able to provide folks? And then looking at benefits. For some organizations, maybe you've looked at your wages or your salary, or as you've looked at that, I think there was a couple comments about that. But did you look at your medical plans? Did you look at offering retirement? Are bonuses important around longevity? Is it important? Would that be something to look at for retention? What else you may want to do if that happens to be one of your drivers or your goals. And then thinking about where are we now and where do we want to be? So really being clear on what the benchmarks are or what your assessment points are as you enter compensation planning, I think can help it be more of a comprehensive process where you're deciding, okay, so we know that wages, we've heard from folks, or we're going to ask folks what's most important to them to come into the organization, to stay in the organization, looking at the salary analysis that we just saw that WSCDF did. There's also several other great resources that can be used to try to figure out, as well as asking your peers in very similar organizations what salaries look like to try to get that information. I think that's part of the justification piece, really looking at what is the comparison that's very similar type positions, as well as location of where we are. And asking people, I think talking to staff, and you probably have feedback already. I know that we've gotten that in the past when we started engaging in a compensation planning program. Is often what we used, or what we did use, is a lot of feedback that we had received from folks over the years about what was most important to them being at the coalition, what keeps them here, what gives them energy to continue moving forward, as well as how can they most successfully take care of themselves in the process of that. So identifying, after that, kind of identifying the process for, so how are we going to develop the plan? That's the who, what, where, right? Like, and how are we going to do that? Who's going to be responsible? How are we going to move it forward? How are we going to bring people into the process? Who's going to approve it? Looking at communication. One of the parts that I think is really important when you think about communication, and that would be the next slide, sorry, thanks. Tracy, we're not able to do that, sorry. Thank you. So communication, think about it on various different levels. So when you're thinking about what are you going to communicate to staff, hopefully you've already kind of gone through the reflection of what kind of information do we want to receive. Have we already received that information and we want to be able to share back like how we're going to be moving through this process. Being really clear up front what you're going to share and the information to be as transparent as you can about the process. And then communicating often, making sure that, as you know, with any other kind of involvement of individuals, making sure that if you promise the communication that you follow through with that. And I think one of the results that we've seen when people have involved staff in specifically around compensation planning is that it can increase employee trust, it can improve engagement, decrease turnover. So there's lots of different rewards to doing that beyond just receiving the best information that you can about how you want to move forward and identify those priorities. In talking to funders, we have a great opportunity here with the VOCA application, but that's not the only funding that you receive. So think about, like, how do we really intentional look at our compensation as an organization for all of our employees, and what other conversations do we want to be having with people around why this is important, what are our values, where do we need to move, and that could be timing-wise. I know that was some of the questions that was brought up, and I'm going to talk a little bit about that in terms of governing as well, but thinking about when do we talk to our funders, you know, beyond this application, when we look at justifying, when we look at the information that's important for our values. So thinking about that as well as what are the main messages that you want to get across. And then, of course, your governing body, whatever that may look like in your organization. It might be your board of directors, you might be in an umbrella agency, it might be a tribal council. So think about ahead of time, what are the best steps that I need to go through to be able to consider roles, strategy, and timelines. Next slide. Tracy, could you please do the next slide? Great, thank you. So when you're thinking about working with your governing body, and I'm just going to use that to encompass whatever that may look like for your organization, you know, really being clear on what their role is and how do you highlight that role with the board or with the governing body. So we know that with board of directors, fiduciary role, as well as policy, oversight is essential and is one of their main roles as a board. So making sure that within an organization you're able to retain kind of the drivers of the plan formation in conjunction with ensuring that the board has enough information to be able to make really strategic decisions, to make sure that items are in line with organizational values, that there's appropriate internal equity or differences among positions and departments, especially if you're talking about, for example, let's say that wage and salary plan is one of the areas that you've identified in your compensation plan that you need to increase wages, that you would be developing that with your group, and then that would be something that you'd be bringing to your board or your governing body for approval, but making sure that you have all the information about why you chose that, what are the values, what was the data that you used to be able to determine what that could look like, how is that something that is affordable within your organization, and address some of those sustainability issues as well. For accredited programs that receive sexual assault monies, this is a requirement for accreditation, that you have a salary and benefits plan and that you identify who and how it's reviewed and approved. And then boards will do final approval of whatever that plan is that you're bringing forward, or council, depending on what that looks like for your organization. No surprise, but will help you to have the conversation, thinking about that ahead of time. You know, where's your board on the compensation train? Are they just stepping on it? Do they need to think about, or they haven't had those conversations? So maybe you need some seed planters on, we need to be looking at this, how are we going to move this quickly? There's a couple opportunities with these dollars, which is really great depending on your timeline. And then thinking about what's worked well in the past when you've had potentially conversations that could be conflictual or challenging or difficult. Judy had talked about oftentimes boards will look at or want to know what's the risk to us, how are we going to sustain this, and how can you be prepared with your data and your information to be able to present this. If they're new to the compensation conversation, you know, what kind of pre-talks do you need to have? Is there an executive committee, board chair, finance chair, another individual depending on that governing body that you're working with? You know, what kinds of things do you think would be most important for them to hear and when to hear? If you've had conversation with them already, like they know this is coming, still being prepared to give the information that you need to be able to frame what the plan is when you're done with it. And for some boards, maybe this has been an ongoing conversation, and here's that opportunity that you've been waiting for. So you're just ready for the ask and being able to make a decision. I think anticipating, you know, what kind of questions or asks the board may have ahead of time. I think one thing that Judy talked about was the risk and sustainability is always top and first or foremost, or should be, with the board, so being prepared for that. But also I think moving folks away from, this is really important for us to be successful. There may be some really critical questions that you need to ask, like, you know, can our staff leave an abusive situation? Can they care for themselves and their families as they're caring for other people and helping support them in their healing process? So really trying to think about what's going to resonate most, as well as what's in line with your mission and vision. And then, of course, timelines are really critical and essential to think about, depending on where you are in that conversation around compensation, thinking about what's the next step and how are we going to map that out. And last but not least, just real briefly, a compensation plan, things that it might include. It could be goals. That's the next slide, Tracy. Thanks. Might be goals and objectives that we talked about, the values. And I think all of this information is going to help address some of the questions that folks were having about formatting of plan, the timing of stuff, the sustainability. When I think of sustainability, yes, we need resources, but we also need to step back and ask ourselves what's most important that we're able to do, and how are we going to prioritize making that work with what we have. And I think oftentimes we've continued in the social service world to do more with less, and this is really a time where we need to step back and be like, we can't keep doing that. We can't sustain ourselves. How can we sustain our organizations? So thinking about the limits are really going to be based on all of the work that you've put into thinking about what's competitive, what kind of data we have had to address our plan. So those goals and objectives are really critical to be able to frame the overall plan. Compensation plan might also include your wage and salary specific information, your benefits information, other monetary values, and defining those. That might be, maybe you have a phone or clothing allowance, or overtime, or on-call, or bonuses, etc. And then, of course, roles is really important, like to be clear on who's developing, who's reviewing it, and who's going to be approving this plan. And it's a point in time as well as ongoing work. So what are you committing to in terms of, okay, so we've done our analysis of the wage and salary plan this year, but in 2 years we're going to do another one, or another one after that. For programs that have accreditation, that's an annual requirement. Also, part of your plan would just be timelines. When are you going to review the plan itself and any portion of the plan and what that may look like? So it's a lot of stuff, but I think the more that you can look at kind of putting these pieces into your strategy is really going to help in those conversations, as well as help in organizational planning beyond this point in time. We're looking at questions right now to see if there's anything specific.
All right. We're going to, pausing for questions and comments. You can. Oh.
It looked like Connie Burke had a comment. Connie, would you like to share? We'll unmute you here in a moment. There she is.
Where's Connie? There she is. Oh, there's two Connies.
Can you hear me?
Yes.
Hello.
Oh, hi. I was just saying, you know, and this might be really too quibbling and people may not have the time for this, but I guess I would say that, you know, executive pay is set by the board, but that the executive director should set pay for their staffs, and of course that's approved in the budget that's submitted and approved by the board. But you know, in my, I wouldn't say that you want buy-in. You want the board to understand that. You want the board to be behind that. You want them to rep it. You want them to fundraise for it. You want them to, you know. But I guess I would just characterize that a little differently. I don't know. It's really important to spend time doing this. I'm curious about how to get this money, so I will be quiet now.
Thanks for your comment. I want to take a few of the questions that we've had so far about, is the application out? Yes, it was emailed by Chris Fenno at OCVA on July 7th, and the subject line was in all caps. So go back and look in your email. If you are a current DSHS or OCVA contractor, you should have received that email on July 7th. Another question is, are bonuses allowable? I think that that's a really, what is allowable is to increase wages and salaries, pay, you know, in general, and benefits, and then FTEs under certain circumstances. So I think that there's a lot of, why would that not be allowable is my thought on that. How much money is it okay to ask for? Should we talk about this now?
Sure.
Okay. So I also want to just give Chris Fenno and Tricia Smith from OCVA the opportunity to respond directly to any of these. We will try to find you in the chat so that we can unmute you. I'm going to look, I would want to just refer everyone to the application. On the bottom of the first page, it says, oh, not about how much to ask for, about will this money be available in future years. It says, while no funding is ever guaranteed, sustainability of these increases is a priority and will remain at the increased level as long as funding allows. So again, the sustainability of these increases is a priority for the state. Congress has authorized these VOCA funds, and I would encourage everyone, and that was a victory by our combined fields and movements. So I would encourage everybody to consider this as more sustainable than many of the other sources of funds that we have for our services. How much money is it okay to ask for? DSHS and OCVA have purposely not put a cap on the on how much people can ask for. And my understanding, again, Chris and Susan and Tricia, please feel free to chime in and correct me where I'm wrong, is that they really want to hear from the field and from contractors about how much money you need. I will point out that there is $6.1 million available. So this is how rare that we get to say that kind of money, right? That we get to say that number, $6.1 million. I would encourage you all to think about asking for what you truly need. And I just had a conversation with the director the other day who said, well, you know, maybe we'll just increase, you know, wages for these employees but not for others because we can't afford it. And I said, well, it's $6.1 million. How, you know, let's help the state spend those funds. It's money that we advocated for as a movement and as movements together. And it has this purpose. This is the designated purpose for it. Okay, so I'm going to pause there and see where we are with questions, Tracy.
Well, we have a lot of questions about the process of the application, which, you know, we are going to get to. We may answer some of them and then be able to clarify some. It looks like Tricia and Chris at OCVA don't have a microphone, but
yes, in regards to the bonus question,
yeah.
It may or may not be allowable. Okay,
but they're you know, figuring that out. And so if we have other questions for Tricia or Chris, we can, maybe they can type in their answers. So I'm just trying to look at time and what makes the most sense. Should we save those specific process questions for when we get to the application section?
Sure.
Judy?
Yes. And
so so your questions will get answered if they're specifically about the like nuts and bolts of the process of applying. We're getting to that, so hold that thought.
I want to go to the we had an FLSA question again. So
and somebody has their hand raised as well. I want to get to that.
Okay, can I do this?
Yes, you do that first and then I'll.
So there was a question about who does the FLSA apply to? So I want to just give you two scenarios to help, because it's complicated. So to help you think this through. So currently, anyone who is a non-exempt employee, that means who is not exempt from federal wage and hour law, they need to be paid time and a half for hours worked beyond 40 hours a week. So that applies already to all employees who are non-exempt. If you work more than 40 hours a week, they need to be paid time and a half. What's changing with the new FLSA rule is that beginning December 1st, exempt employees, that is employees who are currently exempt from wage and hour law, who earn a flat salary, who so far up to this date have, no matter how many hours they work, get paid the same amount. Beginning December 1st, those employees who earn less than $47,423 a year or $913 a week will need to be paid time and a half for hours worked beyond 40 hours a week. So that would apply, for example, to an executive director who earns $45,000 a year and typically works 41 to 50 hours a week. That organization, if that organization decides that the FLSA rule applies to that position, that position will need to be either paid more, at least $47,423 a year, or that position will need to be paid time and a half for hours worked beyond 40.
Okay. And Michelle Douglas, I see you have your hand raised, so I'm unmuting you now if you want to ask your question. Go for it. Are you there, Michelle? Oh, no. Hello?
It looks like you're self-muted, Michelle.
Now you're unmuted. Are you there? We can't hear you, so my guess is maybe your mic is not working on your computer. You don't have one. If you want to type in your question, we will get to it that way. All right. I'm just taking one moment to click through and see if there are any non-nuts and bolts application questions that we want to get to. Okay. It looks like we will go back through here when we have questions and comments after we do a little overview of the application to see if there are any that are unanswered, which I think there will be, but then we can address them at that time. All right.
Okay. Coming up. Financial modeling. So we're going to get into some nitty-gritty here and Excel spreadsheets. It's important as we go through the process, many of you are commenting that we need to forecast what the costs will be. So this is where we'll also look at cost allocation briefly. So here are some different scenarios that you might be wanting to model. What would it cost to increase the salary for each exempt position to meet the FLSA threshold? What would it look like if we did, say, a $2 an hour increase for hourly staff? What would it look like if we did, say, a $2,000 bump to all base pay for all employees? What about a 3% COLA? What about a 10% pay differential for bilingual staff? What about increasing health insurance? And then don't forget the cost of payroll taxes. So we're going to unmute our friend Sherry Tinoco now from Emergency Support Shelter in Kelso. There she is.
Hi, Sherry, you're unmuted.
Hi.
Hello. Hello, can you hear me?
Can you speak closer to the microphone, please? Sherry? Uh-oh. Are you there?
Oh, we heard you for a second, Sherry, and now you're gone.
Oh, sorry for these technology problems, folks.
Sherry, if you want to toggle your switch to call in, and under audio, click on telephone and it'll give you directions to use your phone instead of your computer, and we can go to the next slide and wait for you and come back to you. If you let us know if that works for you via the chat or questions. Yes, looks like that's what she's doing. All right. So is it okay to go?
Yeah, so now we're looking for Christine.
So now Christine is up. Let me find you. Hi, Christine. You're unmuted. No, it's not working either. We can't hear you, Christine. Are you talking? Sorry for the technical difficulties. Christine, I think maybe if you want to do the same thing that I just suggested to Sherry, toggle your audio switch to telephone and follow the instructions, and then we'll come back. Maybe Sherry is already ready. We'll see. Hi, Sherry.
Hello, how are you?
Hi. So can you walk us through, thank you very much for generously sharing your spreadsheet here. Can you walk us through what you're doing?
Sure, no problem. So what I prepared, it's an Excel spreadsheet, and what we're looking at, or one of the things that we're looking at for our agency, is a per hour increase for staff. And so what I did at the top part of the Excel spreadsheet where it says increase per program per hour, that is where we've calculated all of the hours per year that each employee in each department works. So we have we're a tri-service program, so we have DV, SA, and CVAP, which is the crime victims. And then we have our administration and our support staff, all of those broken down to give a total number of hours per year. Then the second box in the middle of the page is the increased cost per program by various rates and hours. So it starts from, if we did a $1 increase per hour, going across to the right shows how much that would be for the DV program, how much that would be for the SA program, so on and so forth. And then if we did $1.50, or if we did $2, or if we did $2.50, that gives the data of what that cost would mean. And then the final box at the bottom shows the agency cost between those methods up above, those of different methods. So the first box, if we took those same rates from above and we applied that only to our advocates or direct service staff, those would be the different costs to the agency. If we, the second column, if we added advocates and administrative staff but not support staff, those would be the costs going down that column. And then the last column is if it was everyone in the organization at any of those rates, that would be the total cost for our organization to implement those. And so that's just our raw data to be able to then look. There might be different, there could be a $2 per increase chosen for direct service staff and a $1 increase for support staff. There's lots of variances that can happen, but this spreadsheet gives the data, so it's easy to find out what the total number or the total impact would be for the agency.
Okay, anything else to say about that, Sherry?
I don't think so, only if there's any questions.
I don't think at this time, but I just really appreciate, again, you being willing to share your internal document with your peers here, and how methodical this is laid out. Thank you so much.
Oh, you're welcome.
Now, Christine,
Let's
we
go
unmute
find
her?
Christine. Yep. Hang on. Hi, Christine. Can you hear us? Can we hear you?
I can hear you.
Excellent.
Great.
We can hear you.
Thank you. Again, thank you for your generosity in sharing this with your peers. Can you just tell us a little bit about what this table is?
Well, it's a small portion of a larger document that I call our salary scale that indicates the increments year by year with a 3% COLA, and also where staff come in starting on the scale, dependent on their years of experience in the field and or education that is relevant. And we also have included a basic increase for acknowledging the skill sets of bilingual advocates and also bicultural advocates. And so it helps me figure out year by year what the increases are going to be. And similarly to the table before, I then take this basic information and I'm able to put it in a second table that then helps me figure out what the increases are by per person, per program, admin, and then agency as a whole.
Great. Thank you, Christine. Okay, we're ready for the next slide.
All right. I didn't know if these were, I was looking at questions, if we had any questions for Christine or Sherry.
Okay, one question for Sherry is, were those all for exempt employees? And I'm going to respond on behalf of Sherry, no, they were not. It was a mix of exempt and non-exempt. Another person asked, can you share the spreadsheet with us to see the calculations? We will check in with Sherry and Christine to see if that's possible. I know that many of you many of you that are CSAPs already have a wage and salary calculation. Okay. And then when calculating the COLA, sorry, should only an initial increase be included? Actually, that's totally up to you. Okay. So some of these questions that people are asking have to do with HR and compensation expertise that I don't know if, I just want to put out there that there are some really excellent resources in the nonprofit world to get specific support around compensation studies, how to do a salary survey, how to do a compensation study for your region, for competitive employers, for example. And 501 Commons has a number of consulting organizations and individuals that they have pre-screened for that purpose. Right. Okay. So preparing for unintended consequences. The funny thing about money is that it can lead to conflict even when there's more of it. We're used to having the conflict with the scarcity, but abundance can also create problems. So here are a couple of scenarios that we wanted to flag for you that we've seen with WSCDIV and WCSAP. The first is an inadvertent drop in staff morale or increased staff conflict around increases in pay. So for example, what happens if some employees get increases that are larger than other employees? And again, this goes back to values and the definition of fairness. It might be an across-the-board increase by a percentage, for example, that's the same for everybody, but the dollar amount ends up being larger for some employees than others. So, you know, to anticipate that and think about how will you define fairness and talk about what's right for the organization and for the people that you're serving. Another challenge that organizations often experience are clashes between the director and the board or a tribal council or governing body about increasing wages when the board is concerned about sustainability, or if there's a strong belief that raising wages takes money away from serving more survivors. So how will you, honor the role that the board has or the governing body has in fiscal oversight and upholding community standards, and also challenge or put forward the important view that you have around supporting sustainability over time for staffing. Third is how increases from some funding sources affect other funding sources in your cost allocation. So will the VOCA increases affect how you're doing allocations for personnel, the percentage of time that staff spend working on non-state contracts, just using this both as an advocacy opportunity for increasing base pay with other funders, as well as just thinking through your allocation formulas. The last thing that we have seen sometimes is an inadvertent furthering of inequality or inequities among staff that fall along lines of race, age, gender, national origin. So for example, could increases end up creating larger gaps based on age, for example, or based on race or gender? And just forecasting that, looking at that and saying, wow, do we have an inadvertent problem here? And then somebody else raised that there can be an issue of a challenge with compression, that if you raise the entry-level positions pay, that gives you less pay incentive increase for folks as they stay on, as they're already getting paid better. Okay, and then let's see, there's one more here. That's a good point. Somebody said, I'd love to hear about organizations that are multi-service and have other programs that are not just DV, SA, or crime victims. It's a challenge with a multi-service organization when you have other programs that are not getting this kind of bump in pay. Yeah, definitely. So thank you, folks, for flagging that. Okay, next slide, please. And then further on these equity issues, because we have of the employees and the field that we're in, or the fields that we're in, we often have employees who can't afford any health insurance premiums. So how do we want to address that? Thinking about, does the pay and benefit structure that we have work for single head of households, including those who are survivors, or does it assume spousal income? Can there be unintended racial gaps in pay? And, do we have any retirement contribution? Do the retirement contributions depend on, for example, employees making a contribution themselves? And oftentimes employees have no retirement savings and no money to save for retirement, right? So, I want to just normalize this, that oftentimes in our fields, the pay and benefit structures predate us, and they were put into place 20 or 30 years ago at the organization. When social assumptions about spousal income, when the housing cost of living, those were very different. When even the assumptions about would anyone retire out of this field because we were going to solve, for example, domestic violence within 20 years, that those assumptions, have had to evolve. And so this is an opportunity, this VOCA funding opportunity is a good time to re-examine what are some assumptions that have been in place, and to have your boards or tribal councils or governing bodies take some time to look at this over time. So not just for the September application deadline, but as a good checkpoint for the organization. Okay, so thank you for spending time with us on talking about some of the larger issues. Now we're going to dive into the application. Yes.
All right, so we're going to give an overview of the application. Sorry, technical difficulties. And then I'm going to go back through those questions and make sure that we address some of the specific questions around the application and the nuts and bolts of that as well. So there will be only one application for organizations to complete, even if they receive funding for services from OCVA, from CVSC program, DSHS shelter programs, or OCVA sexual assault program. So just one application, that's good news. There's two parts of the application. There's a narrative and there is a Excel budget sheet. Compensation enhancement is the theme here. The VOCA plan includes additional funding to address staff recruitment and retention challenges. The programs can apply for salary, benefits, and administrative or indirect costs. Salary, benefits, administrative, or indirect costs. Programs may also apply for to add benefits only. If you want new or expanded benefits is being requested, but no salary increases. So that's also a possibility. There is also an option for FTE enhancement. So the plan includes funding to address the need for additional FTE in cases where a program has less than one FTE currently dedicated to providing direct services and or has a need for additional FTE to provide basic services. You'll need to explain the problem that you're facing and why, why the additional FTE will address the need if you're applying for that. The deadline is September 30th. So completed applications due by September 30th. Awards will be made through grant and contract amendments beginning in November. So I think some people had some questions about when. So September 30 deadline, awards happening beginning in November. There's questions and answers that will be posted on the OCVA website. There's a link there. And then I have a link to Chris Fenno's email and phone number for more information about the specifics, but I want to go through and try and get some of the questions answered here about that. So keep writing in your questions. I'm going to scroll back up and start getting to that. And Jean and Judy can help me answer these questions as well.
Can I
yes. Oh, yes. Judy's got some.
So somebody asked, is it okay to ask to raise your entire salary structure? That is something that many programs will be doing. Are there different applications for DVSA and crime victims programs? No, it is one application. Say more about the number of years that funding may be available. So this is our understanding, and again, Chris Fenno, Tricia Smith, and Susan, if you'd like to comment on this. Our understanding is that the VOCA funds are available for 3 years, and then during that period, Washington State will be demonstrating the impact to Congress. So this is one of those things where none of our money is assured, and some of our money is more stable than others. VOCA funds have been around for a long time, and Congress did a major expansion of VOCA, and again, thanks to our collective advocacy. And so this is the result of that. And well, I don't know if anyone else, Jean or Sandy, if you have anything more that you want to say.
No, not at this time.
Okay.
All right. Did you have any others in your list there, Judy?
Can these funds support increases that we've already made or enhancements that we've already made but are having trouble funding? That's a good question. I don't think I know the answer to that.
I don't either.
So I think we could put that on the list of things that perhaps OCVA and DSHS would respond to in their Q&A in July.
Yes. Okay. That would be great. There are also several questions about, like, for instance, is there a cap, either in a dollar amount or percentage of the current budget that you can apply for? Some people are asking, is there a ballpark figure that you can apply for? And there's not.
We have asked that question several times to our esteemed colleagues. The answer is no, because what they have said is they really want to hear from the field. Will all programs be funded, or will it be competitive? I think that is an open question. Because again, they have said that they really want to hear from the field. Can funds be used for office space or supplies or that kind of thing that go with expanded staff? There's nothing in the application that refers to office space or supplies or other costs of staffing. It is only related to compensation and FTEs.
Yes.
Some people are having trouble printing. We will follow up with you on that.
The handout.
Yeah. How to come up with a living wage for staffing. Tracy has some excellent resources for both by county and then the field as a whole.
I mean, I think a good place to start is the Self-Sufficiency Standard and there was a link that I gave in this. It's thecalculator.org. And again, it's a place to start. And I say that because, again, it is a bare minimum for folks, and you can look at different family makeups and whatnot, but it's the making ends meet, just making ends meet kind of data numbers, but it's good information to know, and you can start from there in your process and you're thinking about that. Bear with us while we look for questions.
So several people have asked, we would like to raise our entire salary schedule rather than just the lowest paid, direct paid positions. There is nothing that prohibits that. I think that would be a fine thing to propose, if I may give my opinion on that.
Right.
Okay, scrolling through.
Somebody asked if there will be character or word counts for the fields on the application. Do you know the answer?
We're not aware of that. I think that's a good question for OCVA.
Yeah, that is a OCVA question. I'm not sure. When I get down to the bottom, maybe they will have answered that in this, or if not, we can find out from them later.
Okay, somebody asked about on-call. Does this mean that if someone is on call 20 hours a week and they work 35 hours a week in addition, does that mean that they're working 55 hours a week and they should be getting 15 hours a week of overtime? Wow, what a good question. So this is the big question for on-call work is what is on-call, and it's going to be different for every employer. Or I should say it's not, there's no across-the-board answer. So for each employer, you'll need to determine, or hopefully you have determined, is your on-call time time where employees are so restricted from doing other activities that they are considered to be at work, or is their on-call time not restrictive to that degree and only when they are actually answering a call are they considered to be at work? So, for example, some employers have employees who have to stay on site, for example, at a hospital where the doctors and the nurses are sleeping in their break room, but they have to remain on site. And that's pretty restrictive. For other folks, they're carrying a pager and they're on call, but they never get a call, and they're able to go about their daily activities. This is a very gray area of employment law. I'm just going to say that it's worth thinking through, looking at what is on the Department of Labor website about on-call time and talking to a local employment attorney.
Yeah. All right. Somebody had a question about how to submit the proposal. I believe it can be via email. I'm pretty sure, but we're checking. Oh no, it says return to Chris Fenno at OCVA mailing address. So maybe Chris or Tricia can clarify if it can be emailed as well with attachments, or if you only want hard copies. We'll try and get those answers for you.
Do you need to include your agency compensation philosophy and plan in the narrative? No. The narrative very specifically, the narrative very specifically just has 2 things to write in per page, right? And just about what's the problem you're trying to solve, and then how will you solve that?
Yes.
Somebody asked, is training and travel considered a benefit? I have never seen that considered as a benefit before. Professional development is usually considered as a separate line item and not part of fringe benefits, which traditionally include payroll taxes and then health insurance and retirement.
Good.
Yeah. Okay, thanks for your patience while we screen through more questions. Someone asked, can this money be allocated for therapy? Again, the funding is allocated for compensation and FTE. Okay, and we're going to wrap up this question section by saying that Tricia from OCVA has said that they will be putting together a Q&A document. Where did that go? Oh, down, down, down. Too far. Okay. There we go. They'll be putting together a Q&A document that will be updated weekly beginning at the end of July. People can send questions directly to Chris Fenno's email. Her email address is Christine, CHRISTINE .Fenno, FENNO @commerce.wa.gov, and that will be posted on the OCVA website.
Mm-hmm. All right.
Okay.
I think
let's just see if there are any more comments that have come through from OCVA.
Yeah, I am. Oh, Tricia says that they can talk now. So I'm going to unmute Tricia and Chris to see if they wanted to verbally address any of the things that we were not able to. Let me find you, Tricia. Oh, I just hit the pen. You got to enter your audio pen, and then we can unmute you. I'm just looking to see if they have. Oh, yeah. Tricia confirms that it is mailed hard copy for the application. You need to mail a hard copy to the address on the application. And
Tricia had asked a clarifying question about the therapy and was this intended as a benefit for staff? I think the question was therapeutic services for survivors.
I thought it was for staff, but
okay.
So it's unclear. I'm not sure about that.
Perhaps you can address that in the Q&A.
Yeah, Tricia, I think I was.
Hi, I'm here now.
Hello.
Can you hear me?
Yes.
Okay, it's a little quiet on our end, so I wasn't sure. Sorry, I had to call in, so I didn't hear the last 2 seconds of what you all were chatting about, so you might have to repeat it.
Oh, we were just commenting on your comment that you were wondering if therapy was a benefit for this, as a benefit for staff or something else, and Judy and I were thought different things, so it was unclear.
Okay.
As far as I thought it was as a benefit for staff, but we're unsure. So if that person wants to clarify, then they can, and we can address that.
Okay, and I can take that back to the group for the Q&A.
Okay, oh, and she actually says it was for clients. Can staff on the specialized portion of the grant have increased pay? Oh.
Yes.
Okay.
For staff, yeah, increased compensation.
Okay. So, Tricia, I think the big question is how much money can people ask for?
How much money can people ask for?
So we've addressed that a couple of ways, and I think it's great for people to hear your response directly.
Yeah, I think that what we're hoping is people will ask for what they need, and I acknowledge that that can be frustrating and it's hard for folks, but you know, let's try it and see what it works and see what it feels like to not operate from scarcity. I think you've outlined a really great list of guiding tools to inform your approach to your proposal, and you know, certainly want things to be sustainable, but also meet the need to have, you know, well-trained, qualified staff and people that want to stay in this movement, and you know, to make our workforce competitive and well compensated. So that's what we're aiming for, and we don't have
a final dollar amount that's going to get us there. We really need to hear from the experts in the field, which is all of you guys.
Terrific, thank you. And Tricia and Chris, could you also speak to the worry that people have, and I think that they're anticipating that their governing bodies will have, which is, well, how many years can we count on this money?
Yeah, I'm going to pass it to Chris for that one.
Oh, how many years can we count on the money? Right now we have 3 years worth of money, and that includes the VOCA 15 and 16 awards. The VOCA 17 funding, we should know if Congress acts like they should by October 1st. And all of this is sort of on delay, just so you know. We haven't actually got the 16 in hand yet, but it has been awarded. We've been given our amount. So come October 1st, we should know the 17, and that is good starting October 1st, but of course we won't get it for like 10 months. And so that would add probably another 1.5 years on to make it 4.5 years, and then if next year at this time the 18 include. So it's really hard to know. If they continue doing what they have, which is to average the deposits of the prior 3 years into the account, we can sort of project out for 10 years because we know how it's been coming in, that we could be looking at anywhere from 3 to 10 years of funding at this level.
Terrific. Okay. We have a number of questions about page limits and character limits, those kinds of things. Is that something that you'll be able to address in the Q&A that will be posted online?
We can, and I also did a quick note back to you just saying that we hope people can just be succinct. We don't want, the thing we didn't want was for this to be a hard application. We want to know what you need and why you need it. And so we are not looking for pages and pages. I mean, if you feel compelled to write it, you can. But what we really want to do is have your thoughts on what you need for your agency. So there are no page limits, there's no character numbers, stuff, any of that. But we kept it particularly short so that it would be easy for the field, as easy as it could be for the field, because there's so much sort of pre-work that has to go into it.
Okay.
We have another question. Will the awards be retroactive to September?
They will not. They will. At this point, we are thinking that they'll be effective December 1st.
Okay.
Okay. And there's a question about the match. Can you speak to the match, please?
Absolutely. And that is also on the question and answer document, because we've already had that question come in. And right now there is match that is required. However, the sexual assault and domestic violence programs have enough state dollars that they are able to continue making that match. And it's the Crime Victim Service Centers who will need to identify match for whatever they're asking. They can also ask for a waiver if they need it.
So organizations that are required to have a match may request a waiver?
Yes, they can request a waiver.
Okay.
I think we are, we have some more questions, but if we're going to go through these, and if we didn't get to them here, we will send you an email, address your questions in that way.
And if you can just send me all of the questions, I'll add them to our Q&A document.
Terrific.
Absolutely. So you can look in the Q&A document for answers to your questions, and that will be excellent. Thank you so much, Chris and Tricia. It's hard to say together. Before we go, I know we are at time. I'm just going to show you a couple of slides we have at the end here, resources and support. There's a video. It's on the Whiskative YouTube channel. It was created primarily for boards and donors of domestic violence advocacy programs to illustrate the importance of investing in staff. So in talking about getting board buy-in and thinking about, talking about these kinds of topics with your governing bodies or your donors, but governing bodies in order to like create these new compensation plans or whatever you've got you're thinking about for this. It's a quick little, we call it a visual lecture, but it's light and fun, but it I think makes a nice point. So that's something, a place you might want to start, or just one resource for you. Here's more resources. There's the link to our wages and benefits survey and more information about good jobs at Wiscative. A link to that self-sufficiency calculator that I talked about a minute ago, and the links that we talked about on the FLSA stuff from 501 Commons and that webinar, and some stuff from the Department of Labor. And reach out to us. You know, we are available. Sandy Green and Jean at WCSAP also are available, but you can email or call Sandy with questions, and I am here for you, and I will help you figure out who you need to talk to about your answers for support around this application process and thinking about these big, new and exciting and maybe nerve-wracking things that you know, we have this opportunity to pursue with this new funding. So we want to hear from you. Can't wait to hear from you. Thank you so much for being with us today.
Yes, and I want to just say this is a very exciting new era of more funding, and thank you all for all the tremendous advocacy that you've done over the years, and then to our colleagues at OCVA and DSHS for listening.
Yes.
Thank you.
Thanks so much, everybody.